Hello, my name is UC. Today I'm going to be talking about maternal mortality, and this is my project. So, introduction to maternal mortality. Maternal mortality can be defined as the death caused by pregnancy issues. It is a great indicator of health of a country. So approximately 295,000 women died during and after pregnancy and during childbirth as well, all over the world in 2020. With proper treatment, most of maternal deaths are preventable. Prevention of maternal mortality is a health organization issue that is given priority at the global scale. Maternal mortality affects not only an individual, but also it can affect the community and it can affect the economy as well. So we're going to talk about the global statistics. In 2020, the number of maternal deaths around the world reached about 295,000 according to the World Health Organization. Approximately 86% of maternal death was in South Asia and sub-Saharan Africa. Low-income countries have maternal mortality ratio that is 40 times higher compared to high-income countries. So countries like third world countries, they're high risk for maternal mortality because the population is underserved and they are very disadvantaged when it comes to healthcare. Considering improvements in maternal mortality have been observed in most areas, but there have been disparities as well. We have countries like Finland and Iceland. Those countries they have lowest maternal mortality rates because those countries they are more advanced and the people there in the country they have more healthcare benefits, so therefore the mortality rates there in terms of maternal care it's not as high as the third world country. The quality of data collection and reporting is different on a regular basis, which influences the quality of the global statistics. So we're going to talk about the causes of maternal mortality. So the second major cause for maternal death is severe bleeding, hemorrhaging, of course, during childbirth, disease during pregnancy, delivery or postpartum. That's why it's very important for women of childbearing age and a women who are pregnant as well to get screening during pregnancy so that the healthcare provider would be able to detect any issues with the woman or any issues that can contribute to maternity mortality. Unsafe abortion has been contributing to a large amount of maternal deaths as well. So we have underlying problems like high blood pressure or diabetes. Most women are prone to gestational diabetes or sometimes preeclampsia. All of these kind of diseases can contribute to maternal mortality. So it's very important for women to get screened during pregnancy to prevent situations like this. We also have complications of cesarean section that can contribute to maternal mortality. Is a very high risk. And then time wastage in getting care of unqualified healthcare professionals. We have the risk factors. Juvenile and mature maternal age predisposes the danger of complications. So poor access to quality healthcare, particularly in a rural area or rural places, can are risk factors for maternal mortality. Poverty as well is a contributing factor. Malnutrition. If a woman is not getting all of the nutrition that she's supposed to get during pregnancy, all of the proper vitamins that she's supposed to consume during pregnancy, that can also lead to complications and can cause death as well. We have bad living condition. If you're not in a good living space, of course, you're prone to diseases and sickness. That is a risk factor for maternal mortality. And then we have underlying diseases such as obesity, smoking during pregnancy as well, hypertension. Those are all contributing factors. Illiteracy and ignorance of maternal health. The less knowledgeable you are about maternal mortality, you are prone for risk of it. You're prone to experience such, or prone to lose your life during pregnancy, because if you're not knowledgeable, of course you're not going to put in the proper care to take care of yourself or to do what you need to do to have a great pregnancy or a healthy pregnancy. So a person who is not really knowledgeable about the risk factors, the causes, and what they need to do to prevent such a situation, they are at a disadvantage of experiencing such. And then, of course, we have sex discrimination and cultural aspects that all impedes access to health care. We're going to talk about the impact on health systems. The maternal mortality is high, straining healthcare systems on a nation, of course, because the more people die, the more the nation or the country have to put more money into supporting that areas. So it can be a burden financially on the healthcare system. High demand of emergency obstetric care services. That's also a high demand that requires money as well, so that can be a financial burden to the healthcare system as well. Mother mortality is a factor that leads to workforce deficiency in medical fields. There is a diversion of resources to other important health services. And then we have the skilled workers and healthcare professionals. If there are not enough healthcare professionals, that can also be a burden on the healthcare systems. The maternal death is a problem of economy and society issues that is mainly concerned with the government. Then we have strategies for reducing maternal mortality. So what strategies can we put into place to reduce maternal mortality? First, we want to enhance availability of qualified medical workers, and particularly midwives, people who have experience in these areas, physicians, to try to reduce the risk. We want to increase maternal health education and awareness. We want to educate the populations of people who are not aware of such. We also want to implement proper care as far as early screening for diseases, immunization during pregnancy, all of those things that can contribute to maternal mortality. We want to expose it to individuals so we can have them not be at risk. We want to make sure that emergency obstetric care is provided on time. There shouldn't be a long time where a woman is in labor and there's no care for her at that time. That can also contribute to maternity mortality. So instead of waiting so long to have that proper health care, we want to make sure that we have health care providers that are available right away. We want to increase the availability of contraception and family planning. We want to empower healthcare in rural and low-income communities, those communities that are underserved and not very knowledgeable. We want to make sure they're knowing about maternal mortality, and we want to provide the proper healthcare for them. We want to enhance maternal health monitoring and collection of data as well. So what is the role of APNs in maternal mortality reduction? So APNs are involved in maternal health management. APNs will have the capabilities to offer prenatal and postnatal services, which will secure continuity of care. They play a very important role in health education by enhancing maternity health literacy, teaching people about what maternity health is, so they're very knowledgeable. They are also at the front line of maternal health policy change, and they can be advocate for maternal healthcare system as well. They're also trained on how to detect and treat complications at an early age. Like I was saying, it's very important that we're able to screen these people early. People who are at risk for maternal mortality, want to be able to screen them at an early stage and see what kind of disease or sicknesses that they have that will put them at risk. So once we screen them, we're able to give them the proper care in a timely fashion. We also have APNs who assist in healthcare teams. They provide people with high quality care that are patient centered. This is a case studies example of the effect of people being knowledgeable and how it can play an impact on reducing maternal mortality. Also, having health care can contribute to reduce maternal mortality. So in Rwanda, maternal mortality ratio has decreased more than 60% because the accessibility to health has improved. A strong program of prenatal care in Sweden has led to one of the lowest rates of maternal mortality in the world. Efforts put by India have also enhanced maternal health outcomes. The maternal mortality rates vary amongst African American women. It brings about disparities in the U.S. that require areas of improvement. So the goal is to avoid disparities. People should not, one set of people should not have health care and the other set of people do not have health care. So we want to get rid of that disparities. Everybody have equal health care and quality health care to reduce maternal mortality. Also, cultural appropriate care in New Zealand has led to reduced maternal death in indigenous population. Once again, the healthcare workers that are working with these people or patients, they should provide cultural competence care, be aware of people culture as well to reduce maternal mortality. And then we're talking about the global initiatives and policies. Goal 3 of the United Nations Sustainable Development focuses on maternal mortality and enduring a reduction of below 70 live births per 100,000 females. The program of the World Health Organization Safe Motherhood Initiative focuses on quality maternal health services. The Every Woman, Every Child initiative addresses the world to commit to maternal health. The international organizations work together to empower health system in lower resources area. The blanket health coverage should be promoted to curb the maternal deaths as well. So these are all global initiatives and policies that are put in place to help reduce maternal mortality. And in conclusion, the maternal mortality is a significant health problem in the world. It's not just a local issue or an issue that is just in the community, but it is a worldwide kind of issue. So access to improved healthcare can help the prevention of maternal death through its preventable courses. APNs are highly needed in minimizing maternal death by taking care and being advocate as well. The implementation of maternal mortality decreases needs internationally by collaborating with other healthcare workers. The health and well-being of mothers in all parts of the world should still be addressed. So these are my conclusion that I have in terms of maternal mortality, just working together as a whole, educating people about their health, whether it's primary care, where we're providing immunization, secondary care by screening them, and just coming together as a whole, making sure that the populations that are underserved and they have low income, they don't have access to these things, making sure that we're providing access to them in that area to avoid or to reduce maternal mortality. And these are my references. Thank you.